Right, here we go. Not the smoothest of starts. So sorry about that if you've been waiting. But let's just get started now. I think that's the PowerPoint sorted and we are recording. So my name's Fadila. I'm a third year dental student at the University of Leeds. And I'm also the Equality, Diversity and Inclusion Lead here at Future Frontline. So if you're not already aware, Future Frontline is basically an educational platform. So we're kind of dedicated to inspiring the next generation of healthcare workers, and also a kind of mouthpiece for current students and professionals as well. And that's basically just to raise awareness of all the different pathways and different roles within the umbrella term that we mean when we say healthcare professionals. So I just wanted to request, I think everyone's done it already anyway, but just to keep your videos off and to keep muted because we are going to post this on YouTube later. So just for the quality and stuff to be optimized. And if you have any questions, feel free to put them in the chat. And then I'll kind of save them for later. So we'll have a little Q&A at the end and I'll ask everybody, all our panelists the questions. So in terms of today, we're going to try and keep the focus true to the webinar's title. So everything you need to know about studying dentistry is basically a work experience event. And we'll be covering like the role of a dental student and dentist, progression in the career, and things like that, why dentistry, rather than things like entry requirements and entrance exams and things like that. So at the end, maybe I'll ask you guys if that's something you'd be interested in. We'll do like a part 2 of this. But for today, we'll just kind of keep the focus to work experience. But yeah, all the Future Frontline socials are at the bottom of the screen there. So feel free to, show your support. Cheeky little plug here. Like and subscribe, all of that stuff. And the website is, I think, on the right over there, left. Great dental student here. So yeah, that's where all our blog posts are. We have podcasts as well. We have a YouTube channel where this recording will be shared later. And of course, we have our Facebook group, which hopefully we've managed to get live on right now if we've done this right. So every healthcare role has a multidisciplinary team behind it, as most of us hopefully know. So it's always great to have an insight into the many different roles and responsibilities there are. So I think the last time a study was done, it was actually found that there were around 350 different roles in the NHS, and that's a pretty shocking number. It definitely was to me. So one of our core mission statements at Future Frontline is believing in a future, as written in the second one there, with collaborative practice at the center of everything we do. And we're also really, really passionate about making this as inclusive and accessible for everybody as possible. So again, as written there, socioeconomic status should never be a barrier to pursuing a career in healthcare. And that's the idea behind, putting our recording up on Facebook later, on Facebook right now and on YouTube later, just so it can be accessible to all of you guys, and hopefully useful as well. So yeah, let's get on to introducing our panelists. We've got 2 dental students. We've got Isabel and Emily, and then we've also got current dentist as well, Dr. Emmy, who's kindly given up her time as well. What I'll do, I'll let you guys introduce yourselves. You'll probably do a better job than me. So Dr. Emmy, do you want to start us off?
Sure. Hi, I'm Emmy. I'm a dentist. I qualified in 2019. I now work for the NHS. I work in Cornwall. And yeah, I love my job. I can't wait to tell you all about it. I'm sure you'll be interested to know.
Definitely. And then Isabel and then Emily, feel free to introduce yourself.
Yeah, so hi, my name is Isabel. I am a dental student at the University of Sheffield. I am currently intercalating and doing a BMed side before my final year starts in August.
Lovely. And Emily?
So I'm Emily. I'm a final year dental student at the University of Bristol. I'm the dentistry lead here at Future Frontline. And I also intercalated like Isabel did, but between my second and third year. So this is actually my 6th year at Bristol. But yeah, hopefully we should be qualifying in the next few months, but COVID has really put a spanner in the works, but we'll,
I imagine.
yeah.
Great. Okay, so I'm going to just start off with a kind of simple question, but kind of a dreaded question sometimes as well when it comes to interviews. Why dentistry? So what made you guys come into this career, this area of study, that kind of thing? So whoever wants to go first can go first. Or I'll just tell you guys.
Go on then.
Go on as well.
So, I mean, like, it's the really cliche answer that you should never give an interview, but I had an interest in dentistry first because I like science and I wanted to help people. And I think that's where it started, but that's not enough of a reason in itself. And we tell you, don't say that in interview. I think dentistry is like a really good combination of the practical skills and, if you like, the creative side of it. I just love having a natter with my patients. That's literally makes my day. I want to hear all the problems, I want to hear all the goss. So for that way, it really suits me. And also, I think like the lifestyle and the working options that come with it are something that really suited me personally. The fact that you can be flexible with what you work, and there's so many different options. So like NHS, obviously private dentistry, cosmetic stuff, hospital dentistry. So I think there's just so many things. But yeah, that's kind of what drew me to it all in the beginning.
Definitely, that's quite interesting as well, because I think a lot of people don't realize how much variety there actually is in dentistry before starting. That was definitely me. Like before ever doing work experience, I was like, okay, I like everything about the career, but am I really going to do fillings all day? And then I did a day at practice and I was like, wow, this is so much cooler than I thought. So that's really interesting. What about you, Dr. Emmy?
So I think along the same lines, the lifestyle side of it, but I also loved how you are providing a practical solution to a physical problem. So a physical solution for a physical problem, because one of the classic interview questions as well is like, why dentistry? Why not medicine? And I think, I mean, the careers themselves, you can see the similarities, but they are just so different as well. And what I loved is, you know, it's very rare in dentistry that someone comes in with a problem and that we send them away with a medication, or we can often solve that problem quite well, and that's quite satisfying. And same again, that mix of academic but creative as well. Like dentistry is such an art as well. And another thing is the continuation that you get with your patients. If you're someone that works in general practice, you know, you're seeing patients not only when they are sick or when there's something wrong, but throughout their whole lives. And that's quite nice to sort of, you know, take care of someone's teeth from beginning to end. So that's quite satisfying too. And then same as Isabel, really, the flexibility and the variety. Like you can make whatever you want out of the career. It's not set in stone, you know. And I loved the fact that I wouldn't have to do things like night shifts. And there are areas of dentistry that you can go into where more hospital based, where you will be working nights and you will be doing that. But the amount of flexibility and variety just means that it will fit with whatever stage of life that you're in.
I really like what you said about continuation of treatment. That was something that stood out to me in my work experience as well. I'm going to go to my work experience a lot because that's really where it was solidified for me. But the dentist I was with, he had a patient who was about 16 and he was asking her about her GCSEs and stuff. And when she left, he was like, you know, I treated her mother when she was pregnant. And I was like, oh my God, that's amazing, isn't it? Like to be able to see that person grow and have treated them the entire time. I just think it's really, really nice and rewarding. And finally, Emily, what about you? Why dentistry?
Yeah, so I first got interested in dentistry when I had some orthodontic work. I was about 14 and both my parents were actually doctors. So I kind of had healthcare in the back of my mind. But when I was, about 15, 16, I ended up doing some work experience and sort of shadowing the orthodontist that had treated me in hospital. And I was just exposed to all of the different aspects of dentistry. Up till that point, I'd only ever gone to my general practitioner and been sort of in and out in 5-10 minutes because I'd never had any sort of dental needs up to that point. And I was just exposed to all of these different you know, aspects within dentistry. And as I got more work experience and as I went into a general practice, the more I found out, the more that I liked. And I loved how practical it was. I loved the whole diagnosis and treatment planning and seeing the longevity of the treatment that you had provided. I just thought that was really rewarding. And I also just love how practical it is. And for me, it was never a case of, oh, I've chosen dentistry over medicine. It was more just that we're doing, because it is so similar, like it's like medicine of a more specific area, and I just preferred dentistry. It was nothing wrong with medicine, I'm sure, you know, if I had gone down that route, I would have been very happy, but I love dentistry and what I've been exposed to it thus far. So I definitely feel like I've made the right choice. So yeah, there's quite a number of things that I enjoy.
Mm-hmm. I think through all our answers, we've just kind of shown that, you know, dentistry isn't just looking at people's teeth all day, which is a question I get quite a bit, like, you know, why would you want to do that? But there's so much more to it. And I think all of our answers, I'm saying our answers, I'm not really a panelist, but, you know, being a dental student, I can kind of relate as well. But all of the answers have really kind of encapsulated that. So another thing I wanted to kind of cover was kind of a day in the life of a dental student / dentist. So shall we start with the students and then kind of progress to what it's like after uni? So Iz, do you want to start us off there? Have we lost Iz? I don't know if she can hear me.
Do you want me to go?
But yeah, go for it. Okay.
I can start. So
yeah, thank you, Emily.
That's okay. So at Bristol, we start very much like the foundations of like the human body. So as you touched upon, it's not just learning about the mouth. Yes, we learn the anatomy of the head and neck in more detail than we do the foot, obviously. But it's very much building the foundations of what's normal in the body. So whether that's physiology, anatomy, biochemistry, and then from second year, we start building up our clinical skills. So before we do anything on a patient, we do it on plastic teeth and plastic heads first. And once we've passed a competency for that, we're then allowed to do whatever it is that we're then competent on with patients. So it's very much building up over the 5 years, and there is a lot to cram in. You know, there are quite a few exams. There's lots of knowledge that you have to know before you can start treating patients. But we were based in the dental school pretty much full time from third year onwards, and it was built up in the sense that we started seeing adult patients for like gum disease, and then it built on to seeing them for more complex treatments, whether that's fillings, whether that's starting on oral surgery and taking teeth out, whether that's seeing children, whether that's making dentures. And then we progress to the more advanced things in fourth and fifth year. So touching on things like oral medicine, and then sort of shadowing on consultant clinics and sort of bringing everything together in fifth year. I would say that being a dental student is very different to being a normal student, very different even to being a medical student. It's very regimented. We're in pretty much every single day. But the great thing about that is that there's such a community feel. You get to have lunch with your friends every single day, and you know, you hear so many stories about what other people have been doing, and you also get to like mix with the older years a lot, which I always really enjoyed. So you could sort of see where you were going to end up. I remember the first time I came to the dental school and I was shadowing, or I think even when I started nursing, we sort of nurse for the older years, and I remember like nursing for a fifth year and being like, oh my goodness, like they just seem like a proper dentist. Or I know that sounds really silly, but I was just like blown away about like how, you know, how great their communication was and their practical skills, and it was just really inspiring to see like, oh my goodness, like in 3 years that could be me. And you do learn really fast, like when you start seeing patients, it just all does all start to come together. But it's certainly very busy, but it's also very enjoyable and very rewarding. But anyway, that was quite a long spiel. I'll let
No,
us
no,
go
no.
if it's working.
I definitely relate to a lot of what you were saying. I remember last year I was definitely in awe of the 4th year I was assisting. I remember just thinking, wow, like she's in 4th year and she's a dentist. I know exactly what you mean when you said that. And it's scary to think, you know, I've missed a whole year of experience now because of COVID, and I'm going to be that 4th year next year. So I have no idea how that's going to turn out, and if I'm going to appear to a 2nd year, how, you know, the 4th year appeared to me. But should be interesting. Isabel, do we have you back? Your sound?
Yes, I don't know if I'll fix this. If I haven't, I'm out of ideas, I'm afraid. But sorry, what?
Hopefully it is, but don't worry, go for it. Tell us about a day in your life as a dental student.
I mean, I do love it. First year at, so obviously I'm from Sheffield, so that's mainly what I'm studying at Sheffield. I'm also from there, but that's what my experience is like. Mostly going to be about. I know it changes slightly from different universities, and you can get like PBL and slightly different ways of teaching. For us, from the first year, we started dissection, which Sheffield is the only university that still does full body sort of cadaver dissection. So if you're into a bit of gore, it's a very interesting way to learn anatomy and very hands-on. And yeah.
Wait, so you guys actually did the dissecting?
Yes, we did the dissecting.
Wow, okay.
So you do, I think, honestly, it was so long since the first year.
I can't imagine.
We've got 1 or 2 mornings a week, and we do torso up, and then in the 2nd semester, spend a lot more time on head and neck.
Right, nice.
A big deal for like the job. So I think that was really good. And then also a lot of the first year was a lot of biochemistry, quite similar to A-level content. So yeah, and like diet and things like that. And then from 2nd year, we started on clinics and started out by making a set dentures, which was great, and used that in a pair. And what else? And like Emily said, assisting older years, which is really, really good. So the 2nd years assist the 4th years, and the 3rd years assist the 5th years. And that I think is a great way to like get exposure to clinic and learn how to do like all the faffy bits properly and get told off for your trousers showing your ankles and all those kind of things that you've got to like get into. So yeah, so generally, like I would say it's a lot more full on than like some friends I've had on other courses. I remember when I got my timetable in 1st year and we were in uni on Freshers Week. And everybody was like, what? And I was like, I can't believe I've got to go to uni. And I mean, it's been like that since, but like, I love the like community of the dental school. As Emily said, like everybody knows everybody, you know, people in different years. Like,
we're usually quite small cohorts, aren't we?
Exactly. So like for me, there's probably about 70 in a year group. Yeah. And I think a lot of places are similar kind of numbers. So you know everyone in your year. Yeah, it's hard work, and there's lots to do and lots to remember.
Lots of
and
time
lots
management
to stress about.
Yeah.
But it is like really rewarding, and you can come off clinic like. So it was sort of what Emmy said about like why she likes the job. Like you can fix people's problems. So even from like that, well, I think maybe it was 3rd year, somebody comes in with toothache and they leave without toothache because of what you did. And it's taken like 3 hours and you've had your tutor over several times, but like you've done that, and that's really rewarding and like great, I think.
Definitely. What about you, Dr. Emmy? Do you want to switch that around and go to oh, actually, I think, sorry, one sec. I think the chat box is actually covering part of your screen where it's sharing on Facebook. If you minimize that, thank you. Sorry, go on, Dr. Emmy.
It's so nice actually thinking back to dental school, like they were honestly some of the best years, and it's so true what you said about your cohort. Like it's funny now, we still have our WhatsApp group from our like clinic group now. Even now we send each other like pictures and advice and say, oh, what would you do for this patient and stuff. Like the friendships you make are a lot stronger because like you said, it is very different from the typical university degree where you get a lot of free time. You're very much together a lot. It's much more full time. It's very full on, but it's so rewarding at the same time. Like, I look back with the fondest memories, and all those years go by in the blink of an eye, and suddenly you're out in the real world. So it's quite nice thinking back. But I mean, if I give a run through of I'll talk about my day to day, for example. So I work in a community setting in Cornwall. So generally I see patients who have some more complex needs. So perhaps they've got medical conditions or special needs, which means they need more time and to be seen in a slightly different, more accessible setting. I also see patients who don't have a general dentist. So in Cornwall, only half the population actually have a dentist at all. So we look after and treat those people that need treatment the most, who don't have dentists. So my job is quite full on. So this morning I spent my morning treating dental emergencies. So that's from trauma cases to people with severe toothache, people with big swellings, really the kind of exciting, gory type of things. So I think this morning we did a few extractions, a few sort of incise and drain, which is nice and gory. A whole variety of stuff. But like you said, a patient comes in with a problem, in pain, quite upset, toothache. I don't know if anyone's ever had it. Very debilitating, very scary. And it's great for them to be able to leave out of pain, because it is one of the worst pains. Then I rang some patients because of COVID. We're doing a lot of telephone triaging now. And then this afternoon, I was seeing some of my medically complex patients. So I think later on we'll be talking about like the multidisciplinary team and things, but seeing patients with a lot of complex needs. So people who have heart problems, people who have problems with their blood clotting, so they're more prone to things like bleeding and infections and things. And treating patients like that as well. So my job's lovely. Like we said, there's so many different things you can do in dentistry. I do a very small amount of private work occasionally, but I like to prioritise my NHS work because we really need NHS dentists. And I do have my own list of patients that I see regularly as well, but I find it so rewarding doing those really high need things as well. It's quite exciting. So that was my day today.
Wow, sounds very full on, but also very rewarding as well. So I think the next thing on the agenda was to talk a little bit about career progression. So I think Emily, because you're a 5th year student, I think you're both intercalated, haven't you? So you probably know quite a bit about the different aspects. So Emily, do you want to start us off here, please?
Yeah, sure. So just as a very general overview, dental school is 5 years unless you intercalate and you add another year on. For those that don't know, intercalating involves doing another subject, whether that's joining in another degree or whether that's a standalone intercalation program. You do it for a year, you get a degree, and then you rejoin the dental program. But if you don't do that, dental school is 5 years, and most people, when they qualify, do a foundation year, which is a year within the NHS that you have to do in order to get something called a national pro forma number, which means that you can work for the NHS for the rest of your career. Not everyone does this. For example, if they went into the army, if they went abroad, if they wanted to go straight into private work, though, that I think that would be quite a jump, but each to their own. So most people do this foundation year, which is done via national recruitment. So we have to do a little situational judgment exam, and normally we have to do an interview, but that was cancelled because of COVID, but I'm sure it'll be back next year. And once you have done this exam, and once you've done that interview, you get ranked compared to every other dental student in the country that's hoping to qualify. And depending on how your ranking is, you then get, you have to rank the places that you'd like to go, and then they match it up. And this foundation is just 1 year, and it's basically a bridge between university and practice life, because it is a little bit of a jump, because in university you have like a long time to see patients. Like sometimes you have patients booked in for like 2.5 hours in a way that doesn't really happen in general practice. And you have a educational supervisor who is there most of the time in practice, that you can always go to if you want to ask something, or if you need a hand taking a tooth out or whatever it is. And you also have about 30 study days across the year for extra learning, sort of to help you settle into practice. Once you've done this foundation year, there are lots of different options. I won't have time to go into all of them, but generally people you can get a job as an associate, so you can be working in a general practice, or you can go down the hospital route, or you can do a bit of a combination of the two. If you do go down the hospital route, there are up to 3 years that are sort of additional foundation years, and you don't have to do all of them. You can do a couple of them and then go back into practice, or you can go into practice. It's very flexible in a way that medicine isn't quite the same. And then once you've done all of that, you can then apply for like specialty programs. So if your heart was set on becoming a consultant orthodontist, you would then apply for the specialty program, which is between 3 and 5 years. But you know, not most people don't do that, but it depends. So that's a very general overview. There's lots of different things you can that you can do, but the general gist is 5 years at dental school, a year foundation, and then once you've qualified and you've got some experience about what you enjoy, you can then make a decision. And to be honest, what I thought I'd love about dentistry when I applied and what I love now, not quite the same. So it's very much a continued process to find out what you enjoy. So yeah.
A lot of information there, thank you. Dr. Emmy, can you talk to us a little bit about the different avenues you can take in terms of where you can specialise and the different aspects of dentistry, just to introduce everyone to that, please?
Yeah, certainly. So there is so much variety within dentistry. So, I mean, you can work in general practice, which is where you're doing almost a little bit of everything, or you can specialize in various different things and be doing those really complex cases. So there's quite a lot of specialities. There's orthodontics, straightening the teeth, then you've got restorative dentistry, which is building teeth back up, replacing teeth. You've got prosthetics, which is things like dentures and adding teeth that have been lost, essentially. And then you've got oral surgery and oral medicine, which is looking at oral medicine is more looking at diseases that affect the mouth but aren't necessarily associated with the teeth, so not tooth decay and things like that. Things affecting the mouth and the oral cavity. Oral surgery is just more complex surgery that goes on in the mouth, so you can go into the oral surgery route, or you can go even further down that route and go into the sort of maxillofacial side of things as well, which is where you sort of combine medicine and dentistry, and you're treating a lot of head and neck things. So that's a hospital-based post, and to actually specialize in maxillofacial, you need to do medicine as well. So that's a very advanced speciality to do. And other than that, we've got endodontics as well, which I always speak of last because it's the thing that I think I wouldn't want. That's the least one that I'd want to specialize in, but that's root canal treatment. It's essentially specializing in root canal treatments of all kind of wonderful teeth. And you have to be a very special kind of person to enjoy that side.
I was actually, the last thing we did in labs, clinical skills labs, was actually root canal. That's the thing I've enjoyed the most. And the whole time I was questioning that. I'm like, why am I enjoying this? I shouldn't be, but I don't know.
It's one of those things that once you get into it, you do really enjoy it. But I think I'm more, I much prefer like more surgical things as well. So that's what's so good. You'll find, and it's so true what Emily said, you go to dental school thinking that you want to do one part of dentistry, and you'll change your mind so many times because you'll be like, oh, this is amazing, or oh, I didn't really enjoy that as much, and things. Yeah. So that's quite exciting. You don't have to commit to one thing. You can stay in general practice, you can do general things. You know, if you don't want to specialize fully, you can become a dentist with a special interest. So you can still do general practice, but say you could have a special interest in endodontics, which is root canal treatment. So you just do some more complex cases of that, people will send their patients to you, and you can spend the majority of your time doing that. So you're quite free to do a bit of everything, decide what you like, decide what avenue you want to go down, and go however far down that avenue you like. You know, you don't, you know, there's no set course that you have to.
Yeah, definitely very flexible, isn't it?
So many different ways to do it, and that's the thing. It's quite good. You know, general practice is always a good place to start. So your foundation year, once you graduate, is great because you are doing a bit of everything, and you'll start to get an idea of, when you see your diary for the day, oh, I've got this and I'm quite looking forward to that. Oh no, I've got a root canal, like, I don't really fancy doing that. So you'll get a good idea of what you enjoy and what you don't. So
yeah, and I think throughout dental school as well, you know how I just said I enjoyed it on, you know, phantom heads, on plastic teeth. It might completely change where there's a real tooth in question and there's a patient
factors, yeah.
When there's blood.
We'll see how that goes. What about you as well? Do you have anything to add in terms of
the other thing I was going to add as well is there's sort of options as well for academic careers within dentistry. And I think a good way to explore that, if you're perhaps interested, is by intercalating, because most of the time you do sort of a research degree within that year, and of course it's not for everybody. But you know, there's options to do things like that, and you can go on to be conferencing and writing papers, and you know, there's very academic routes that you could go down if that was an interest to you. So I just think that's like another thing that's just worth putting in there.
Yeah, absolutely. Like non-clinical roles as well. So I know a few people that have gone into dentistry and actually found the clinical side of it a bit too stressful. And you know, if you're someone that doesn't want to be patient facing all the time, there are other options to be a little bit less clinical as well. So that's
yeah, I mean, like, just to add to that, I think dentistry can be really flexible in the sense that you can do something slightly different every day of the week if you wanted to, whether that is going into a bit of teaching, whether that's looking at the sort of the slightly bigger picture within dentistry. So you can go into dental public health, do a bit of research, like Isabel said, and then, you know, work in one practice or two practices. It's so flexible, and I think we have the opportunity to have amazing like career development as well, and progression throughout.
It's a lifelong learning thing, isn't it?
Yeah, absolutely.
Okay, the next question we had was talking about key skills a dentist should have. So for everyone watching, these are things that you might want to be reflecting upon when it comes to like writing a personal statement and things like that. So Isabel, do you want to start us off with some key skills?
Yeah, so I think communication is quite an obvious one for all healthcare professions, but I think dentistry as well, it's really important. Being able to sort of communicate to people without jargon, so without using words that, you know, are too technical. People might have different levels of understanding, or even want to know different amounts of things when it comes to dental treatment, because some people, just the idea of it is horrible and they'd just rather you did it and not know. So it's about I would say communicating with your patient and knowing what they are comfortable with. I would say for university and probably for the rest of your career, a really important skill is reflection. You have to do a lot of it. You have to be able to write what you did right, what you did wrong, what you do again next time. And to start off with, you're a bit like, oh my God, like it weren't fine. It's not, I don't know. But I think you really do have to get into it in order to develop yourself and like be able to critique yourself, but also acknowledge when you've done well, and you know, and be pleased with yourself. Absolutely, that's part of it. So I mean there's so many skills, so I'll let some of the others say some others, but I would say there's sort of two really, really important things that jump straight to mind for me.
Yeah, Dr. Emmy, do you want to add on to that?
Yeah, sure. I think to second what Isabel said, I think communication is probably the most important thing now in dentistry. You know, our generation of dentists is so different from perhaps the dentists we would have seen when we were children, and the emphasis is so much more on communication. You could be the best clinician in the world, you could do the most perfect filling you've ever seen, but if you're no good with the patient, they're not going to want to come back and see you again. Patients remember how you made them feel, not the work that you did. And we're often starting on the back foot with patients as well. Patients will come to us with the, you know, you have to have a bit of a thick skin as well, because patients you'll be told that you're hated lots of times a day, or, you know, not personally, but they'll come in and say, you know, I really hate the dentist, I'm so nervous, you know. So you're actually having to do more than you know,
go the extra mile.
Exactly, to help them feel comfortable. And you know, thankfully dentistry has changed a lot in the last couple of decades, and there is that much more emphasis on communication, consent and things like that. So that's great. Practical skills are obvious. You kind of have to be good with your hands, and having skills to be able to demonstrate that is really important as well. As a dentist, I also think having the right mindset going into it. If you're someone that has gone in sort of starry-eyed and think that it's going to be a very lucrative career where you're super rich and you can just make loads of money and stuff, I think you have to come from a place of really loving it and enjoying what you do, because there's many easier ways to make a lot of money if that's what your goal is. I wouldn't recommend a career in dentistry. You know, there are times where it's very stressful and you really need to have a sense of purpose. So I think genuine love of the career, otherwise it, you know, it is something that's, you know, stress levels are very high. It would be a very sad life if you're not sort of loving what you're doing. And I think one that I've certainly developed throughout my dental school experience and my career is the ability to work with others and in a team. I feel like during my A-levels, I was so independent. I would revise alone. I liked to do things independently, whereas you're going to spend your life working with others, and dental school is amazing for building that team working relationship as well. So a lot of these skills, you know, you don't necessarily have to go in having these skills. A lot of exams in dental school are not written exams. You'll have, you know, face-to-face exams where you're expected to speak, you're expected to role play. That was not me naturally during A-levels. You know, you get to sort of sit in an exam and put your head down and go back to questions and stuff. So actually building the confidence and, you know, ability to speak, that's something that definitely comes with it. But you the interview process alone going into dental school will sort of select those that are naturally most open, able to talk, and able to express themselves. So I think that's something that's very important.
Definitely. I think what you said about not having to have all the skills perfected before you come in is really important. Like, I remember being quite worried because I wasn't very good with my hands. Everyone was talking about, you know, being very manually dexterous, and I was like, right, the most I do is decorating a cake. Like, that's what I put as my hobby for manual dexterity. I was a bit worried. And I remember, like, in clinical skills labs, I was very, very, very shaky with a handpiece, first of all. And now, where am I? I'm saying my favorite, you know, part of clinical skills is endo. So that's something that's really, you know, intricate. You know what I mean? So don't feel like, you know, you have to have all the skills coming in. You'll be surprised. I think Emily said this before. You'll be surprised at how quickly it develops, and, you know, how quickly your confidence develops as well. But definitely have those things. Go on, sorry, Iz.
No, I was just going to say, I would completely agree with that as well. Like, I think you have to want to work with your hands, and obviously that's a very big part of a job, and like, you can't be a dentist if you're not willing to do that. But at the end of the day, they are there to teach you how to do the fillings, and they will teach you how to do the fillings. So you're not expected to know how to do that. You're just expected to be interested and motivated enough
and willing
to want
to learn. Yeah.
And then, like, you know, you've got 5 years, you'll pick it up. So don't worry. Well,
you see it a lot, like first and second, like second and third year, you're very harsh with yourself. Like, I've definitely done that, where I'm expecting myself to pick up the skill straight away, and I'm so harsh. I'm like, why doesn't it look perfect straight away? But I always have to be reminded, you know, you're here to learn. And so watch yourself develop, and you honestly see it, you know, third filling in, you see a massive difference, and it's just really rewarding. And then to be able to transfer that to patients is going to be something else entirely, I'm sure.
I think just to sort of round off that general section is that I think the most important thing, which we've all alluded to through everything that we've said, is that you need to want to treat patients, because like it sounds so fundamental, but you're going into a healthcare profession, you're going to be professional at the end of the day, and yes, you need to enjoy working with your hands, yes, you need to you know, have communication skills, but they're all things that you will develop at dental school, but you need to want to develop them, and you need to want to be doing the best for that patient. So I guess it's just what Dr. Emmy said, you just need to be going into it for the right reasons. And hopefully that should come across in an interview, if that's what you decide to do.
Definitely. And then the last bit is, thanks. Last bit is talking about the multidisciplinary team. So linking back to, you know, the core aims of Future Frontline again. They're important, like we said, in every single healthcare career pathway, and very important in dentistry. So can you guys tell us a bit about, you know, who we work with as dental students and dentists? Do you want to start us off, Emmy? Dr. Emmy?
Yeah. Oh, you can call me Emmy, by the way, Dr.
Sorry.
Yeah, so I've been so surprised, actually. I feel like I used to have this vision that a dentist just sat in their surgery, treated patients, like sent them off. The multidisciplinary team now is something that's becoming so important in all healthcare settings. And when you look at particular patients, you know, we've got an aging population. A lot of patients we see, particularly older patients, but of all ages as well, are on multiple different medications, will have different medical conditions. And actually a lot that we do in the mouth can affect someone's treatment. It is all linked, so we need to make sure that we're treating these patients safely, and quite often that involves liaising with other people. So just today I was speaking to a patient's cardiologist, and we are trying to work out, they've got a blood clotting disorder and they take medication for that, so we're having to adjust their medication slightly so that we can safely remove that person's tooth and things like that, which is exciting. We had a very interesting case recently when I spoke to a patient's psychiatrist because they've got mental health issues, including what's it called, Munchausen's or I think, and so she struggles with believing that she has serious medical conditions when actually she doesn't. So this patient comes into our emergency clinic and requests to have all of her teeth removed, despite there being nothing wrong with them and things. So it's really important that these patients are taken care of. And I think one of the most important reasons that it is so important to work as a multidisciplinary team is when it comes to things like safeguarding. So, for example, particularly children, when you learn about safeguarding is something that once you go to dental school, it will be a factor throughout every single year and then throughout your career as well. You know, a dentist, for example, we are seeing not just parts of the population that are poorly, we're seeing everyone. So we might be the first clinician to notice that something is wrong, that, you know, we might be the first to notice that a child is being mistreated or be in an abusive home or is being sexually abused, and it's really important that we are alerting our colleagues and following safeguarding protocols, because quite often in cases with safeguarding, it needs to be a multidisciplinary approach. If that's not reported, and then perhaps the doctor noticed something but didn't report it, and perhaps this, you know, unless we're bringing all of this together, things are not going to add up as correctly. So and then, you know, within dentistry, there's a huge disciplinary team as well. You know, you may have a patient that you've treated for years and they come in and they've got an unusual ulcer in their mouth, and actually you need a specialist in oral surgery to see them. So you might want to refer, you'll be corresponding with that member of the dental team as well. So that's something that's exciting. Dentistry is not just in this little dentistry bubble. We're very much part of like the wider healthcare team.
Definitely. Anything else to add, Emily, or as well?
Yeah, so I think we are very much interacting with the wider healthcare team, but we also interact with people within like the dental world. So we cannot work without our dental nurse. You build up such an amazing relationship with the person that you're working with. It's all about four-handed dentistry. It's all about, the nurse handing you something before you even realize that you needed it. But there's also lots of different members of the dental team. So for example, we can see a patient for the first time, do a treatment plan, and then we can sort of delegate sections of the treatment to different members of the team. So for example, if a patient had gum disease, you could refer them to a dental hygienist who could carry out that work for you that you've prescribed. There are also dental therapists that can do any type of filling. There's loads of things they can do. They can also do all the gum disease work. They can take x-rays if you ask them to. There's lots of different aspects. And as well as the dental nurse, we can't work without dental technicians. And dental technicians make the things that we use as dentists every single day. So if you see a patient and you decide that they need a crown, you would prepare the tooth for a crown. You would take a mold of that tooth and then you'd write a prescription and you send it off to the dental technician and they would make that crown for you and send it back to you. And you have to have a really great relationship with your laboratory, with your nurse, with your receptionist, with the hygienist, with the therapist to make, the treatment for the patient as best that it can be and to make your working life pleasant as well. So there's many members of the dental team, but there's also working with the school nurse, working with the general practitioner, working with, as Dr. Emmy said, referring to oral medicine or oral surgery, or referring to specialists if you see a patient and they have something that's too complex for you as a general dental practitioner. You will refer to a specialist endodontist or whatever it is for them to have little aspects of treatment. So there is a whole, it's not just you in your room with your dental nurse and your patient list. Like there are so many different people involved in the wider team.
And I would just add to that as well. I think Emily briefly touched on it, but whenever you're talking about the dental team, like if you're in practice, include your practice manager, include your receptionist, the people that are booking your appointments, managing your diaries, calling your patients, because they're all part of the experience, and finding appointments that suit certain people if they're working, and late night clinics, and just loads of things like that. So like it's not just the team of like the actual providers of the practical work, and there's a lot more that goes on behind it, and I think they're like people that really should be valued and like considered as part of the team as well.
Definitely. I think it's something that's really emphasized right from when we start at uni as well. I'm not sure how it works at all the unis, but at Leeds we actually get taught in collaboration with the dental hygienists and therapists in first year. So we're all in the same year and then we kind of split off after first year, but that's already created that kind of bond already. And then straight away, I think someone mentioned earlier, we work as nurses and assist the higher years. So, we have experience working as different members. We also work in prosthetics labs. And, I think it was a couple of weeks ago, we were learning how to make dentures and we were shown all the different kind of steps it takes to process just one cobalt chrome denture. And it's amazing how much work goes into it. So I think seeing all of that as a student really gives you the appreciation for different members of the team. And it's really important to show that later in life when we're actually practicing. Yeah, I think that's everything I wanted to cover, to be honest. And we're right on time because I wanted to aim for about an hour. Not sure if anyone's put any questions in the chat, so I'll just have a look. And if you guys have any questions now, please pop them in. Oh gosh, a lot. Okay, here we go.
So I'll just stop the Facebook recording and then I'll come back to answer questions. Just so
yeah, sure, if you want. We can leave them on if you want, to be honest.
It's just if people's names come on and they don't.
Of course. Go for it. More clued on than I am. Fair enough. Okay. All right, is it all sorted?
Possibly.
Hopefully. So what do you find stressful about being a dentist? I'm assuming this is mostly aimed towards Dr. Remy, but we can answer as well. So if you start us off, Dr. Remy.
Yeah, time restraints are always something that can be stressful. That's probably the day-to-day. So for example, if you're doing an emergency clinic, you don't know what's going to walk through the door. You've only got a limited amount of time. So that can be quite a stressful aspect as well. I think it does take an emotional toll on you when you're supporting patients through a treatment. So if you treat a lot of patients that are quite nervous, it takes a lot to support a patient like that through treatment. So it can take a bit of an emotional toll on you. So I think I think that would be the case with any sort of patient-facing role. It requires a lot of organisation, timekeeping skills, great teamwork, and just keeping all those balls in the air can be quite stressful. It can be it's so rewarding, but you do have to maintain a high level of consistency throughout the day. Your filling that you do first thing in the morning needs to be equal to the one that you're doing last thing in the day. So maintaining that level throughout the day when you are tired and things. Other than that, there's a lot of other responsibilities on dentists, like we have to do a certain number of hours of additional studying every year. So whether that's going to courses, reading, so there is some commitment outside of your working time to learning new things and improving other skills as well. So again, you can adjust your timetable around that. It is very flexible, but the nature of the job means that it's high pressure, and I think that can be stressful at times. Really rewarding, but it can be stressful.
Definitely. Do you have anything to add to that?
Well, I can just lead on to sort of the next question, because it's sort of about the stressful aspects of being a dental student. So I think, like Emmy touched on obviously quite a lot, like it is quite a stressful job. You have people's care in your hands, like you can't really mess it up. You have to be able to deal with medical emergencies. Hopefully they won't happen very often, but you are likely to have to deal with a couple, and you'll be taught how to deal with them, but you have to be able to stay calm and to be able to manage that. I think UDAs is something that really stresses me out, and I'm not even at that.
You hear so much about it, don't you?
The dental contract is a mess, but anyway, that's a different story. And I think as well, just dental student, I think it's just a lot of work, and like it's quite a lot of pressure. And the universities, they try and be nice, and they don't want to put you under a lot of pressure, but you put yourself under that pressure because you want to do well. And I think it's just, like it's not easy, but then you have really good days and it's worth it, and then you think, oh, I'm one step closer to graduating, and or you have a really nice chat with your patient, and it's just things like that. So
you really sound like you've been practicing for years and years the way you're talking about it.
No, like, it is. I don't want to lie, like it's hard, like uni is hard, but it's if you think it's worth it for you, and for me, like it is worth it, like it pays off. So I don't know, Emily.
I think the thing that I find stressful as I'm about to graduate is the sort of looming threat that we're kind of taught about from the day that we started dental school, of litigation, which is something that medics don't really have the same stresses. So apparently dentists in the UK get sued more than dentists in the US, which I was so surprised about when I first heard about it. But it's the pressure of wanting to do the best for your patient every single day, and every single patient you see, you want to be on your A game. But there's also the thought in the back of your mind that if the filling was a bit deeper than you thought it was, or you didn't quite explain every single risk that could happen, and then something goes wrong, that not only you'll be upset because the patient's upset, but also you could be financially implicated. So that's definitely looming. And as a potential new graduate, that is definitely at the back of my mind as I'm graduating. So I would say that is stressful. think someone else asked how we deal with stresses. So for me, I am a hockey player, so I've played sport throughout my whole 5 years at dental school, and just having something that I can completely switch off. I don't have to think about what happened during my day. I can just run around with my friends and not have to think about it. I think just having something outside of dentistry, outside of dental students, outside of, you know, what happened in your day, I think is really, really important for your mental and physical well-being. So yeah, that's what I do personally. Obviously that got a bit ruined because of COVID, but we're getting back there now.
Yeah, I definitely agree. You really need an outlet at the end of the day or at the end of the week, just to kind of take your mind off everything. I'm kind of going to join in as well. I think something that's very stressful for me as a dental student is, and for a lot of my friends as well, I think it's the expectation that we put on ourselves. I feel like a lot of dental students come in, and a lot of us tend to be like perfectionists, used to kind of being high achievers and things like that. And we expect ourselves to pick up skills and things like that very, very quickly and be perfect in the way we're delivering treatment, speaking to patients, things like that. And I think often that can be the most stressful part of it all, you know, little things like administering LA for the first time. It's a very like nerve-wracking process to go through. I remember when I had to administer LA for the first time, I think it was like my second week of second year, and I think the tutor got me mixed up with another student and said, you know, don't worry, she's done it plenty of times. And I was like, yeah, I just smiled, you know, to keep the patient happy. And I remember seeing my hand shake, but I couldn't let the patient know how nervous I was because I wanted them to have confidence in me. And it's managing all those emotions in that moment. I think that can be quite stressful. In terms of being in terms of stress as a dental student, I think, like you guys said, it's having that balanced work-life balance in a sense. We have a lot of work, often a lot of lectures, a lot of content to cover. So it's just about being very organized with your time, which often isn't the easiest thing to do. If any of my friends are watching this, they're probably thinking, hypocrite, like I'm not the most organized person, but you kind of learn those skills as you go along and you become better at it. So don't let the stressful aspects put you off too much. I know we're focusing on it quite a bit in the questions. Like we're all saying, I think the rewarding aspect of dentistry as a whole really pays off for the stressful parts. Okay, let's move on to some other questions. Okay, I've got a few very specific questions about requirements. What I'm going to do at the end, I'll ask you guys, or as we're going along, if you guys maybe type a yes in the chat after we're done with questions, just to let me know if you think it'd be useful to have like a part 2 of this, more focused on things like entry requirements, UCAT, BMAT, how to choose a dental school, different things like that. So rather than, I know I'm quite conscious of time, rather than going into those kind of things, we can maybe have a part 2 if you think that would be useful. Okay, another question. When do you think is the best time to get work experience? Do you want to take that one?
Yes, best time to get work experience all the time, whenever you can, any work experience you can get. Obviously it's very difficult at the moment, and I appreciate it must have been impossible for you guys compared to what it was, you know, for myself a few years ago. I think work experience can be anything. I think if you can get dental specific work experience, if you can go into a dental practice and watch, that's great. If you can go into a medical practice, if you can go into a care home and do some volunteering, if you can just go to work in a shop for a bit, even free work experience in a shop, volunteer, you know, then you can say you've worked on your communication skills. So there's loads and loads of ways that you can get work experience, and I think you just have to see everything as an opportunity and think what have I got from this, because you've always learned a little bit of something, and it's sort of putting that spin on it, not even the spin because you have, but you know, realizing what you have got from it, and being able to use that. So I don't know exactly what it's going to be like as far as like specific dental work experience goes in the future. I know some universities do have programs where they do try and offer it, because dental practices, I think, find it harder and harder to do so, just for time constraints really, insurance and things like that.
I think I would also just to add to that is dental schools are acutely aware of the impact that COVID has had. Like, it's massively impacted dental schools, and it's massively impacted people being able to get practical work experience. But there are so many resources out there now that people have created during lockdown, whether that's a podcast talking about dental school or life as a dentist, whether that's tuning into something like this, whether that's just having a chat with a dental student or a dentist, even for 15 minutes or half an hour. As long as you're reflecting on it, like, you have something to talk about at an interview, you've got something to put in your personal statement. And I would say, just as a very like general point, that I always said that it's more about variation rather than about like quantity. Yeah. So as long as you've got an idea of roughly how the dental careers works, you know a bit about dental school, you know a bit about that dental school specifically. That's what they're looking for. They're looking to see that you're engaged and you're interested, and that you know roughly, well, you're not going to know everything, because I still don't know everything, but that you know roughly what being a dentist is like, and that you have picked up the ideal attributes of a dentist, and we've spoken about all of them: manual dexterity, communication, professionalism, all of those kind of things. As long as you can think of an example, and as long as you can just get a general idea of what being a dentist is like, you're going to be fine. So don't over stress about getting physical work experience, is what I'd say.
Definitely. Dr. Amy, do you have anything to add there?
Yeah, I was going to say, I mean, it takes me back to the whole process of finding work experience and applying to dental school. So I'm someone who's come from a totally non-medical background. None of my family are dentists. None of my family are medics. And I remember feeling very intimidated by the whole process when I was applying and when I was starting out, because it can be quite scary, and it just reminds me, going back to that. So I mean, I remember writing my personal statement for university and really not having a lot of influence from other clinicians. So now there's amazing things like Instagram, there's dental students and dentists that are happy to have a look at your personal statement and things. So just get as much input, try and absorb as much from other people as much as possible. And if you are lucky enough to have links in your family and such, that's really helpful. But don't be afraid to reach out to other people if you don't as well, because it is really scary applying. And I remember going to interviews and my mum was there and she was looking around going, oh my gosh, Emmy, all these people look so smart, so clever. And I said, oh, thanks, Mum. Actually, I did get in everywhere, and actually I did do well in dental school and national recruitment and things like that. So I think the whole process of it can be very intimidating. I love what you said about wanting to make things accessible to everyone, and I think universities, dental schools are way more conscious of that now. And it can be intimidating if you don't come from that kind of background, but don't be deterred, because it really is open to everyone. So yeah, really don't be afraid to reach out. I get messages all the time asking about similar questions to the ones we've answered tonight, and I'm always more than happy to answer people's questions and help them with the process.
I think most of us tend to be, because we've been through the process ourselves. We know how daunting it can be, so anything we can do to help, I think most dental students and dentists I know anyway are like more than happy. Just to round up an answer to what you said about work experience, the question about work experience, I think it's really important what is said, anything counts as work experience. All skills can be transferable to dentistry, because dentistry requires so many different skills. So jump on anything and everything you can do. So before uni, I had a lot of like voluntary experience. I think I worked a bit with a mental health charity. I did a bit in an adult disability centre. I did a bit with children in a summer club. So already you can see there's 3 different kind of audiences there. And so the first thing I can say is adaptability. So I could adapt my approach to elderly people in a care home, but also at the same time to younger children. And as a dentist, I'm going to see both. So I think it's said, it's about spinning it. So yeah, I've spun it in a sense, but it's true. I was able to develop those skills, and it's just about, go on, sorry,
I was just going to say that is literally so true. Like, one of the most useful things, the most useful work experience I got was a job that I had where I worked in a children's out of school club. I gained more from that now, when I see my children, my child patients, I gained more from that experience than I did from just like observing. So literally anything you do, you know, extracurricular can be linked back in some way.
That's why reflection is so important, and that's why I think that's why dental schools, and that's why all of us have mentioned that at least once in this little webinar. It's the way you reflect on your skills and what you learn on your experience, and what you learned from that. That's what really ends up counting. What sort of hobbies do universities like when applying to dentistry in terms of manual dexterity? Do you want to go for that one? I think we'll just do one person answer one question, just conscious of time.
I would say anything. Like if you're using your hands, you can do it. The more obscure, the better, because you'll stand out at interview. You know, if you've built a computer from scratch, or if you like cake decorating, or if you've darned your point shoes, or just anything. Like there are a lot of things in life that you do with your hands. It could be your makeup, it could be nail art. I'm trying to think of some more that like are less like really good.
Less like building up a computer.
Yeah, I just hate decorating my makeup. But like there's so many things, you know, things like DT, you know, like working with circuit boards, like soldering, like any of those kind of things, woodwork, just honestly anything that uses your hands. There will be something that you do most days, or that you like to do that you know, you might be a great drawer. I honestly was terrible at art, so you don't have to be able to do that to get into dentistry.
So was I.
They were like, don't take it for GCSE, so I was like, okay. But you know, anything, like just as long as it's genuine and it's something you can do. You could be like the fastest person to solve a Rubik's Cube, I don't know, like anything,
yeah. How did you choose your dental school? So maybe we'll all do this with like one sentence if we can. So I'll start. I chose my dental school. I go to the University of Leeds. I think I mentioned that. I chose it because when reading about the course, I saw that they did early clinical exposure. I'm quite hands-on, and that's something that appealed to me quite a bit. We're also the only uni in the UK to offer a master's in dentistry, so I think at the time I was just enamored by the sound of that. The other thing was opportunities that Leeds kind of offered. So one of the things was the ability to join an exchange program abroad. I don't know how that's going to work. It was supposed to be next year. It's COVID now, so I don't know if that's going to happen, but that was something that attracted me initially. In a nutshell, what attracted you to your dental school?
So I'm at Sheffield. For me, location was a big thing. I didn't want to be too far away from home. I wanted to be in the north. Dissection, I love at Sheffield, and place to offer that. Why Sheffield? They do elective, which I didn't get to go on, so that's turned out great. But you spend 6 weeks like running around Australia or Indonesia, and you know, doing a bit of dental experience out there. Yeah, I don't know. I just like it. I like the people up north.
Emily, sorry, I cut you off there.
Conscious of time. For 5 years, and honestly, it was like the best time. Like, I'm sorry, but northern people are so lovely. I love living in the north. Now I'm back down south. But yeah, for me, I did graduate entry, so there's only a few universities that do that, and I went to the University of Central Lancashire because it is heavily weighted on clinical experience, which is what I wanted. And small sizes, you know, in my group there was 6 of us, so you know, like 6 of us in a group. So in the entire year we had 29. We were split into 4 different groups, so a lot of my teaching, there was just 6 of us, so that was great. We're here talking about small cohorts being like 17. I'm so shocked.
I think it's sorry, the other thing just I've got to say about Sheffield, clinical experience starts in 2nd year, so
yeah. I think all of us went for early clinical exposure. What about you, Emily?
So I wanted to be in a place that I knew I was going to be living in for 5 years. So I wanted it to be a city that there was a lot going on. I'm from Oxford, so Bristol's not too far away from where I live. I'd heard really amazing things about the university. In terms of the dental school, I love the fact that the dental school was so close to the rest of the university and that we didn't have to move away anywhere. So I felt involved with the rest of the university for my whole degree. As I said, I've played hockey the whole time. I don't live with dentists, I live with other students, which I think is really nice, just as a bit of a break. And I just really liked the people that I met when I went for the open day and when I went for the interview. And I love it. But to be honest, I've never met anyone that's gone, oh, I hate my dental school, I really wish I'd gone to blah. Like wherever you go, you'll enjoy
You'll end up loving it, definitely. I think I'll do 2 more questions and then we'll just stop it there. I think we've got a lot of positive kind of feedback for that second session, so hopefully we'll be able to organize that for you guys soon. Just stay tuned on like Instagram and the rest of the social medias for more information on that. Another question, I'll just direct this to like one of you guys. If you wanted to do max facts, could you qualify as a dentist and work as a dentist while studying for the rest of max facts requirements?
Message. So
oh, you messaged them?
Yes, I was just saying, yeah, you probably could, but it would be really, really difficult. You'd do your dentistry for 5 years, then you'd have to do your foundation year in order to work for the NHS, and then you'd have to study medicine. So if you can study medicine and work part-time, then technically you could do it, but it would be very, very challenging.
We had someone in our year, I think he dropped out now, so probably not the best example, but he was a surgeon and then he was going to do 5 years of dentistry. But he was also like a father of 3 kids or something, and I remember him coming in with like, you know, really big eye bags and stuff. So I think it was a very difficult kind of feat, but probably not impossible. So if you really wanted to, you probably could.
We have 2 qualified doctors in the Oberlo who joined in second year, in like the second year of dental school, because they both want to do max facs. So it does happen, and some people, I mean, there are at least 2 people in my year who are coming up to qualifying and now want to apply to medical school because they like max facs so much. So yeah, it is an option. It's not impossible, and it is very, very interesting. But you know, it's a lot of years in education. It is.
Yeah. Okay, final question. Somebody's asked, do you think, it's just scrolled off. It was something like, do you think if, you know, you're not a high achiever with like a straight A student, would you have a chance at becoming a dentist? That was so stuttery, but you get the drift.
I know at Bristol, and I think that there are a few other programs across the country, you can do, it's kind of like a foundation year. So if you haven't got the grades that you needed to get into dental school, you know, in first year, because the standard offers 3 A's, you can get contextual offers. So always bear that in mind and always check that on the website. But you can do a foundation year, which would mean that you would be at dental school for 6 years and you would learn like the sort of foundations of the dental degree. And these programs are competitive, but they are an option if you don't get the A levels that you anticipated. So always have a look at those. I know that there's one at Bristol, and I think there might be one at Birmingham, but I could be wrong.
Thank you. Okay, so I'm going to go back to sharing my screen. And this is the bit that a lot of you have been asking about, how to get your certificates for attending today. So let me get up on the whoopsie daisy. So those are our upcoming events, but we'll be posting about them soon enough. And then basically this is where it's at. So if you guys fill in the feedback form using the QR code on the screen right now, that will enable you to basically be sent the certificate from us. And then also on the right, there's a QR code to support us. Very voluntary, but you know, it'd be very helpful for us to keep everything, you know, like we said, as accessible and inclusive as possible. I'm also going to actually pop a link into the chat box if I can find the chat box. Just give me a sec. And then I will, there we are. So I'll just pop it there, and also put it on the Facebook one as well, but I think the Facebook people have kind of left. So I'll put this back on full screen. If you guys fill in that feedback form, oopsie daisy, what is going on? And then, yeah, we should be able to send that certificate out to you. Because I'm conscious of time, I'll kind of just end it there. So thank you to everyone for joining and giving up your time. Like we said, we know work experience is kind of difficult for you guys to obtain at the moment. So hopefully this, webinar has been useful, but also a way for you to kind of claim that work experience and show that you have that understanding through attending. This webinar was completely voluntary, so the fact that you attended it shows that you have initiative in itself. And thanks as well to our panelists. You guys have been so great today. I'm sure everyone's learned a lot from you. And I think the way, I'm probably going to think this anyway because I'm a dental student myself, but the way, we all talk about dentistry was really inspiring and enjoyable. I always love talking about it, and I hope everybody else enjoyed it too. So yeah, a big thanks from me and the team at Future Frontline. And yeah, guys, hopefully we'll be back with a part 2 to this. I think a lot of you have expressed interest in that. So stay tuned on our social medias, and hopefully we'll see you all soon.